I want to welcome everybody to tonight's presentation on Bridging the Gap, a multidisciplinary approach to hamstring rehabilitation. This is part of our Sip and Study Soiree series that is hosted by the Young Professionals Committee. Tonight's presentation is sponsored by Twin City Orthopedics. Our first presentation today will be by three gentlemen. The first is Eric Perkins. He received his Master's of Science degree in exercise science from North Dakota State University, where he spent the last 5 years as a strength and conditioning coach for NDSU football team, while earning 4 national titles, as well as 1 year with javelin throwers, earning a conference title and coaching 2 All-Americans. Prior to coaching, Eric played football for NDSU, earning 4 more national titles and setting an NCAA playoff record for the most punt return yards in a game. Eric utilizes his knowledge and experience to develop the entire athlete in the weight room, on and off the field, and on the meal table. Garrett Eggleston received his Bachelor's of Science degree in kinesiology from New Mexico State University in 2020, and then completed his Master's of Science degree in biomechanics from the University of Nebraska, Omaha in 2022. He studied attentional focus, cueing, and the effect of kinematics and kinetics for rotational athletes. Garrett's passion is in using technology to collect, analyze, and translate biomechanical information to others. And our final speaker is Tyler Wheeler. He's a certified athletic trainer that utilizes current evidence-based interventions to provide every patient the professional level of care they deserve to ensure their timely return to activity. He previously served as the human performance resident for the UND men's hockey team, where he helped lead the Fighting Hawks to 2 Penrose Cups. Tyler currently serves as the medical liaison for Minnesota Elite League Hockey and Training House's NFL Combine Prep. He also co-leads the ACE program across TCO, where he helps establish non-operative and post-operative return to sport programming. Gentlemen, take it away.
Hello, everyone. My name is Tyler Wheeler, and I'm an athletic trainer at TCO Training House, and I'm joined today by sports performance coach Eric Perkins and sports scientist Garrett Eggleston. We'll be presenting on our multidisciplinary approach to treating hamstring injuries here at Training House. Before we dive into the therapeutic intervention, we must first understand the hamstring's anatomy, histology, and epidemiology. Starting with the semitendinosus and semimembranosus, both originate from the ischial tuberosity and insert at the medial tibial condyle. These 2 muscles run parallel to each other and make up the medial compartment of the posterior thigh. The biceps femoris is comprised of a long head and a short head. Like the semi-10 and the semi-mem, the long head of the biceps femoris originates from the ischial tuberosity, but inserts at the fibular head and the lateral tibial condyle. The 3 hamstring muscles are considered biarticular. Biarticular muscles span between 2 joints and have different muscle actions at each joint. It is important to note that all 3 hamstrings are primarily responsible for hip extension and knee flexion. It is their opposite function about the tibia that sets the muscles apart. The semitendinosus and semimem control internal rotation of the tibia with knee flexion. Internal rotation is crucial for shock absorption in the lower extremity. Specifically, it facilitates ankle dorsiflexion and foot pronation. In cases of decreased internal rotation, the increases of stress on the meniscus and the cruciate ligaments can be exponential. The same can be said for external rotation about the tibia. It facilitates ankle plantar flexion and foot supination. So in summary, the medial and lateral hamstring muscles act in opposition to prevent injury to the meniscus and our cruciate ligaments. Now that we know the anatomy and biarticular function of the hamstrings, let's dive into the histology to get a better understanding of the muscle fiber architecture. The hamstrings are primarily made up of type 2 muscle fibers. In addition to providing powerful, rapid muscle contraction, type 2 fibers often rely on anaerobic glycolysis and thus have low fatigue resistance. The arrangement of these fibers also plays a factor in how that muscle functions. Fibers can be aligned in parallel or pennate fashion, as you see here to the right. The alignment has a direct effect on length-tension relationship. Pennate muscles such as the biceps femoris and semimembranosus are capable of producing large force outputs, but are more rigid with little length change. This makes them more susceptible to injury with a mechanism that involves contraction at the terminal end of the range of motion. On the other hand, semitendinosus is considered to have both parallel and pennate alignments, making it a fusiform muscle. The parallel fibers make up the muscle belly, while the pennate fibers make up the musculotendinous junction. The semitendinosus is a resilient muscle due to its fiber arrangement. It also offers both high force and velocity outputs throughout the range of motion. When we think about injury risk factors, the biggest risk factor for hamstring injuries is ironically a previous hamstring injury. Rehabs often go unfinished due to our athletes being good enough, and good enough often means that our athletes have passed some functional test, but in reality, the tensile capacity and endurance of these tissues hasn't been physiologically normalized bilaterally. Which leads us to our next risk factor, muscle asymmetry. When we compare musculature strength, we look to ensure our athletes have above a 90% LSI or limb symmetry index. We allow up to a 10% negligible difference to account for limb dominance and sport-specific adaptations. Anything above a 10% asymmetry compared bilaterally warrants corrective intervention. We can also look at hamstring to quad ratio. For this opposing relationship, we have a target range of 60%. Establishing anterior versus posterior chain dominance can provide clinicians key insight into the prevalence of recurrent soft tissue injuries. Lastly, we have fatigue. When fatigue sets in, our neuromuscular control and coordination of motor unit firing decreases. This physiological hiccup causes decreases in performance and increases injury risk tenfold. Hamstring injuries often occur as non-contact injuries, and here are the four most common mechanisms of injury. First off, we have our accelerative or our sprint type injuries. These occur as the hamstring is concentrically contracting, usually at a large length change that occurs with overstriding. Second, we have our transition injuries. These occur when there is a rapid opposition of concentric and eccentric contractions seen in the top video here. Our third mechanism are deceleration injuries. These occur when the eccentric load is too much for the muscle to handle and is often seen in the video below. And lastly, we have our stretch injuries, which usually occur in terminal hip extension and knee flexion, which our example at the bottom almost gets to. Classifying grades of these injuries can be a big gray area in our profession. Without MRI imaging to definitively assess the extent of the muscle injury, we are left to our subjective history and our objective exam and our background knowledge we have just covered. That's why I encourage you to consider the three subtypes that I've listed. Myofascial consists of our connective tissue in like the muscle belly, our musculotendinous injuries that occur right at the musculotendinous junction, and our intertendinous classification that happens within the tendon itself. Hamstring injuries occur at the highest rate in athletes between 16 and 25 years old. The prevalence of these injuries are also more common in male sports, specifically soccer and American football. Hamstrings are one of the most common things to re-injure, as we discussed a couple slides back. As many as 15 to 20% of primary hamstring injuries re-injure within 2 months of initial return to play. And of those, 25% happen within the first 7 days of return to play. According to the NCAA study cited above, the average time missed from injury was 12.4 days for males and 10.4 days for females. But what was their return criteria, and what was the re-injury data? Later on, we'll be discussing a case study on how we objectify our return to play progressions to decrease the likelihood of re-injury. But for now, I will hand it off to Coach Perk to talk hamstring performance characteristics.
All right, so perfect. So when we go over hamstring performance characteristics, those are critical for sprinting, change of direction, as they place significant demands on the hamstring muscle group due to their role in propulsion, deceleration, and stabilization. So first, going over sprinting performance characteristics, there's the eccentric strength and deceleration capacity of the hamstring. So during that late swing phase of sprinting, the hamstrings work eccentrically to decelerate knee extension as the foot prepares to strike the ground. So those eccentric forces can reach 8 to 10 times body weight during that maximal sprinting, particularly in the biceps femoris long head. So having a strong eccentric capacity reduces the risk of hamstring strains, which often occur during this phase. Next, in the early stance phase, the hamstrings work alongside the glutes to drive the body forward, particularly into like triple extension. And this concentric action is key to generating those propulsive forces. There's also a major neuromuscular coordination aspect to hamstrings and hamstring injuries. The hamstrings coordinate with the quads and glutes to optimize stride mechanics, where rapid activation and deactivation of the hamstrings during the sprint cycle rely on precise motor unit recruitment and neural timing. This coordination and eccentric strength will show up in a side-by-side slide here coming up of one of our athletes running on a treadmill. Next, there's repeated sprints lead to hamstring fatigue, right? Which reduces eccentric strength and increasing the injury risk for that said hamstring. So keeping long sprints relative to your sport in your training year round will help maintain that performance and reduce injury risk throughout the season. Next, stride length and stride frequency depend on your hamstring power and elasticity. So having optimal length tension relationships enhances your sprint efficiency. During the late swing phase, the hamstring's maximally stretched, requiring adequate flexibility to avoid an overstretching injury. If your athletes never regain that length tension relationship, they're either going to be decreasing their stride length or their frequency to keep their hamstrings from those maximally lengthened positions, which is going to most likely make your athletes slower. So being able to get those length tension relationships back up to where they used to be is what we need to get working on. Next, going on those agility performance characteristics or cutting and pivoting, that requires the hamstring to stabilize the knee and the pelvis while managing those rapid deceleration and accelerations in multiple planes. So similar to that late swing phase, that eccentric strength of the hamstring controls knee flexion along with tibial translation to decelerate the body and prepare for that new direction that you're going. Those high eccentric loads occur as the hamstrings stabilize the knee, protecting ligaments like the ACL. This is especially critical during those single leg landings and your sharp cuts. And those cuts involve lateral, rotational, and vertical forces, where the bicep femoris stabilizes the knee and pelvis in the sagittal and transverse planes, while the semitendinosus and semimembranosus assist in that medial knee stability, counteracting those valgus forces. Now, your rapid force production is needed to accelerate the body out of cuts and change directions. The hamstring contributes to that hip extension and knee flexion to initiate the new movement direction. The ability to produce this force rapidly in the proper direction separates your average athletes to your elite athletes. So much like sprinting, the hamstrings, quads, and core communicate to ensure smooth transitions during directional changes. Poor communication leads to injuries. So that proprioceptive feedback from the hamstrings help maintain joint alignment, body positioning during dynamic, unpredictable movements. And those repeated cutting efforts, again, fatigue the hamstrings and reducing their ability to stabilize the knee, increasing the likelihood of hamstring strains and ACL injuries. Research suggests that eccentric hamstring strength deficits contribute to a 2 to 3 times higher injury risk during those high intensity cuts. And traditionally, we break down the gait cycle shown above or shown in this slide in the following phases: your stance and swing phase. Inside the swing phases, we break it down into the initial swing, mid-swing, and that terminal swing phase, or the late swing phase like I was talking about earlier. When returning from a hamstring strain, we want to pay attention to how the athletes look during the terminal swing phase. That phase is going to provide insight in the athlete's ability to eccentrically control the foot contact and cycle through motion. And next, I'll hand it over to Garrett.
Perfect. Thanks, Eric. My name is Garrett. I'm one of the sports scientists here at Training House, and I wanted to sort of piggyback off what Eric said earlier and give you an example of how data supports what he said. So here's an example of how we understand if the athlete is symmetrical during each phase of the motion. In this phase, we're looking specifically at that terminal swing. And as you notice, there's a little bit of asymmetry there, about 4%. That doesn't seem like a lot, but gait is a very symmetrical thing. So anytime we see a difference greater than 2 to 3%, that it raises a red flag. So as you can see, the athlete has increased time spent in the terminal swing phase on the right side compared to the left. The right side in this case was the involved limb, and this athlete is performing a return to run protocol following a hamstring strain. After a hamstring injury, oftentimes athletes have a slower terminal swing phase because it's either lower velocity or increased duration. And this can be due to a couple of factors. One being maybe they're mentally scared to pull their leg through and complete the cycle. This commonly leads to a reduced turnover speed. Coupled with this, you will commonly see increased braking forces on the involved limb due to that slower terminal swing phase or lack of a cycle, which may lead to a slight overstride. The red arrow pictured above indicates the braking force asymmetry that may be seen when returning from a hamstring strain. Ideally, braking forces are symmetrical or not present, which would indicate better running economy. When athletes are passive, they are relying on their bony structures to propel them forward instead of relying on their musculature. In the following slide, we will show what these data points look like visually to help you cue the athlete. So in this example, this is the same athlete, just the visual portion of that report, where we're going to show how those braking forces and increased time spent in terminal swing show up. The left limb is the healthy side and the right limb is the injured limb. As you can see, the right shin angle is pointing away from the running direction. We call this a negative shin angle. Whereas if you look on the left side, he has a more neutral shin angle, or it's more vertically oriented. This shows the athlete's lack of ability to increase the rate of turnover and cycle on the right side because he's not able to get his foot under his hip as much, leading to that negative shin angle. The overstride and negative shin angle on the right is usually coupled with higher braking forces and a more passive running strategy. This may put the athlete at risk for bone stress injuries. Increases in the athlete's turnover will be a goal of the athletic trainers and performance staff, helping this athlete return back. Bone stress injuries may occur due to an overstride, increased braking forces, and vertical displacement. This individual has 2 of the 3 risk factors biomechanically, so emphasis will be placed on encouraging a more effective turnover strategy and reducing braking forces. This will make the running strategy more active and increase the demand versus having to rely on those passive structure like bone. So in this example, we are using a markerless motion capture to create a 3D reconstruction that allows us to generate metrics that we can track over time. Motion capture is the gold standard for estimating joint angles. There are a lot of benefits to motion capture. In this case, the biggest benefit is that we are able to go out to the football field, set up our cameras, and collect the athlete moving naturally. Traditionally, motion capture systems are lab-based. However, with this new technology, it allows us to meet the athlete in their setting and better understand the role of how they interact in their environment. By capturing this data, we can provide insight into sagittal and frontal plane mechanics and track specific metrics over time. When returning from a hamstring strain, this view will allow us to compare triple extension patterns side to side and make sure that we are able to fully engage in triple extension bilaterally. At toe off, athletes who are coming back from a hamstring injury tend to exhibit greater knee flexion and less hip extension on the injured extremity compared to the uninjured extremity. This strategy is potentially a compensation strategy that may be used to protect the hamstring. Further strength testing and clinical evaluation may be warranted to tease out if the limitation is due to the hamstring itself or if it's a technical problem that will be addressed through drill work. So here is a different type of view, but the same idea. On the right side of this page, you will see we track certain metrics for our 10-yard acceleration. We can track any change over time, whether it may be good or bad. We can track very simple things like distance covered in the first 3 steps, time, speed, center of mass displacement, and we can track more complicated metrics like shin angle at each foot contact, knee drive direction, and triple extension patterns during acceleration. 3D motion capture provides coaches with a unique opportunity to give their athletes feedback in a way that these athletes can make actionable change. We also track things in a more accessible manner. For example, we can measure a flying 10 time using timing gates and calculate their top velocity. Having a top-end speed data point for all your athletes will help you modulate return to sprint progressions later on. 50% effort can be a very inconsistent way to return athletes back to sprinting. Being able to track speed as these athletes are building back up is a great way to make sure the progression is more controlled.
Next up, we're just going to kind of touch on a case study that Garrett, Perk, and myself kind of encountered this summer. We had a 24-year-old male prospective NFL linebacker with a grade 2 biceps femoris injury. It was a myofascial subtype. His initial date of injury was May 15th. He had a subsequent re-injury on June 13th before coming home for break. He had a 4-week rehab stint here with us in Minnesota, and his goal was to be back to 100% when reporting back for the start of training camp on June 16th.
So when testing athletes for a return to play and throughout a rehab, there are some things to consider. So the first thing that we have to consider is what tissue is injured. And in this case, why do I care? So the biceps femoris is more active from 15 to 30 degrees of knee flexion, whereas the semi-T and the semi-M are more active in that deep knee flexion. So in this case, this individual had a biceps femoris hamstring strain. Therefore, in order to test early on, I need to go to deep knee flexion so I can protect that biceps femoris as best I can. Choosing a position that is safe to engage in allows us to test more often and more regularly with the risk of re-injury going down. So in this case, we chose to do a 90-degree deep knee flexion isometric once again, to protect that biceps femoris, while also being able to test earlier in the rehab to provide insight into how asymmetrical this athlete actually was. Isometric testing is a great way to increase the number of testing points that you will be able to have access to while keeping the risk of re-injury early on extremely low. Isometrics tend to be more stationary strength tests that provide insight into capacity. When returning to play, isokinetic testing may be more appropriate depending on the situation and what metrics you're wanting to look at. So how can we move this from a lab-based situation to something that a lot of athletic trainers and people in training rooms may have access to? So with this individual, we used a Biodex, some 2D motion capture, force plates, but there are other tools that we could use to do something similar. The first thing that we could use is an app called OnForm, which is a markerless mocap that is fairly cheap, provides good consistent joint angles, and is a great teaching tool. So you would be able to track things like triple extension patterns, overstride distance, things like that. It is very simple to use. It can be shot from an iPhone or iPad. I'm a big fan of it. The next is a Tendec, which is basically a strain gauge that can be used to test isometrics. And then, of course, you have your handheld dynamometer, which is pretty much in every PT clinic that I can think of. If I could only have a single piece of technology out of these three, I would choose a Tendec. It's extremely cost effective and can help inform your rehab approach. If you go online, they're about $200 and they sync Bluetooth. So all you need is a smartphone, which I don't think we're lacking any these days. This example above shows that same 90-degree isometric test with a Tendec and handheld that we did with a dynamometer. Yeah, the positions may be a little different, but you're still testing in that deep knee flexion. When choosing an isometric versus an isokinetic test, there are a few things to consider. We will discuss some of these differences on the following slide. So we're going to talk a little bit about force velocity profiling and understanding the difference between isometrics and isokinetics. The graph on the left is a standard force velocity profile. Force and velocity have an inverse relationship, which means as we speed up the velocity of the contraction, the athlete's ability to produce force decreases. An isometric task will be peak force because the velocity is zero. The graph on the right is an example of how the force velocity profile would work if I were evaluating a hamstring strain isokinetically and isometrically. Early on in a rehabilitation, isometrics are more likely going to be used as they present less risk to the athlete. Isometrics are great because they give insight into the athlete's capacity, how strong they are. If you do an isokinetic test that is too fast, the athlete will be able to hide that asymmetry because they can't produce enough force on either side and it's moving too fast ultimately. If I was evaluating somebody with a lower extremity injury and was wanting to do multiple isokinetic tests, I would do one at 60 degrees per second and then a second one at 180 degrees per second. 60 is a good way to evaluate strength isokinetically. Once you get up into that 80 to 180 degree range, you're more looking at speed. I find that if you go any faster than 180 degrees per second, the majority of athletes aren't able to produce enough force for this to be a valuable test. If you go faster than 60 degrees per second, you may find different findings. Testing at higher speeds isn't a bad thing. You just need to be mindful of the force velocity profile and understand what area of the curve the athlete is operating within. If an athlete has a deficit at 180 degrees, but not 60 degrees per second, the athlete doesn't necessarily need to focus on strength. They need high velocity or speed work. If the athlete has a deficit at 60 degrees per second, but not 180, they need time under tension and strength development, not power production and high velocity work. Distinguishing the differences between speed zones is integral to creating data-driven programming that will train the deficit you want to target. So moving forward, initially we did a biodex to look at two things. We wanted to first look at this individual's quad strength by doing a 90-degree isometric, and then we also wanted to look at this individual's hamstring by doing a 90-degree deep knee flexion isometric. So this individual had a quad symmetry of 71% and a hamstring symmetry of 70%. This tells us that this athlete needs to be asymmetrically loaded during strength training. When analyzing quadriceps relative strength, we want both legs to have a relative strength over 90%. However, with this individual being an NFL athlete, we want their quad strength over 100% relative. This athlete will focus on giving the right side more stimuli compared to the left to increase the quad and hamstring relative strength. A standard 4-to-1 ratio will be used to provide additional stimuli to the right side. Anytime we are evaluating the lower extremity, we are looking for a symmetry between sides of 90% or better. Symmetry, or limb symmetry index, is calculated by taking the weaker side and dividing it by the stronger side. Research says that individuals who have 90% symmetry or better reduce the risk of lower extremity injury. In our lab, we use a soft cap of 90% as a guideline for return to play. However, there are many other factors that may influence a clinician's return to play clearance decision.
So once we know the strength and our range of motion deficits, we can really set up our rehab continuum. As Garrett said, we'll definitely need to load this athlete in an asymmetrical fashion to correct his deficits noted on his biodex data. To do this, we will first promote collagen reorganization and normalize our range of motion, which brings us to phase 1. Promoting collagen reorganization is really a major player in whether this rehab will be successful or not. Collagen often gets laid down in a randomized curly mess as the body tries to heal, seen in image B to the right. The reality of this is that we can expect pain, restricted ROM, trouble regaining strength, and a high likelihood of re-injury. In order for our collagen to heal like that it is in image A, proper loading needs to first be established. Starting with isometrics, we need to find a duration and length tension relationship that is tolerable. Once we find it, we progressively overload into isos lasting up to 75 plus seconds. Then isotonics and eventually eccentrics. Do not underestimate this phase because this is our building blocks and this is our base. We can normalize our range of motion utilizing lengthening exercises, which serve to decrease the neural tone of our posterior chain. Phase 2 involves building tensile and power capacity throughout the range of motion. This is where we add our dynamic movements and progressively overload with external resistance as we progress through heavy, slow eccentrics, rapid concentric movement, and isokinetic power. Phase 3 is our sport-specific movement phase, which will be carried out concurrently with phase 2, and Coach Perk will dive into this deeper in a little bit. So first we have our dynamic lengthening. A couple exercises that I like to utilize here is our ret looping, really flossing the posterior chain here. We have a 90-90 knee extension with a little toe pulse. And then lastly, we have our hamstring glider. These often remain in our rehab continuum throughout the entire rehab process. Next, we get into our collagen reorganization phase and some of the exercises that I like to utilize. I'm a big proponent of early on controlling the resistance with manual. So oftentimes I will ISO them at 90 starting with bouts of about 20 seconds. Then I'll move them to 60. And eventually get them to around peak torque of the hamstring, which is about 30 degrees. And again, building up those times as the patient can tolerate. Then we get into some isotonic work, tempoed out. We can build in a dynamic lengthening movement with our isotonic banded good morning. Notice we're going double leg to protect the injured side. As soon as they're ready to progress, we can go with a stagger stance or a kickstand stance to isolate the affected side. Something I like to think about in my rehab progress is how can I work backwards from our goal, right? So if our goal is ultimately I want them to be able to do a Nordic hamstring, I want to start back and regress, right? So oftentimes I'll often start with a double leg Nordic isometric. Then we can get into a Russian to where they're moving through the range of motion. And then eventually getting into our Nordic. Again, I like working backwards here. So if my goal is triple extension and rapid stride like progression, and I want to be able to get them to coach perk and get them running, I got to make sure they first can get some triple extension. So we'll start them off with a triple extension sled march. Sorry, my videos are not loading. And then we can work into a triple extension sled bound. And then eventually in to our rapid stride rate there. And I apologize, my videos are not loading. The first couple did, but. All right. Moving into Coach Perk.
Yeah, so now we'll talk about how we actually organize the hamstring return to play running program. And first off, we'll start out with just like the top priorities that we're looking for while we're trying to return these athletes back onto the field. So main thing, we're trying to reestablish those top end running mechanics, that cyclical shape, right? Not necessarily that acceleration or pistons action, as you see, right? Cyclical running puts more stress on the hamstrings compared to acceleration, where the hamstring isn't the main driver. And so we want to create that volume under low stress environments where they're comfortable intensity, right? So say the very first time we're going out there, we're doing a couple skips, going into some jogging, and it's at 30, 40, 50%. Then we're programming our distances. So things are at 10, 15, 20 yards. They know exactly where they're at. We got cones set out for them. And then this may come as a surprise, like no duh, having clear turf area. Because every once in a while, like if you have a busy clinic, you know that there's always random people that are going to be walking across the turf back and forth. So making sure that you have a clear turf area so then they don't have a crazy environment that they have to work through as they're trying to do their hamstring running protocol. So the focus during these sessions is going to be on stride frequency over length, reestablishing those neural pathways of cyclical running. And we're going to incorporate with that proper strength training that Tyler was just showing beforehand. Now the constraints for this, right, our progression is going to be short to long, slow to fast, and then linear to multi-directional. So again, we're starting out with 10 yards. We're going very slow, starting out with skips, then jogs, then working into some cycling actions. Then we're going to start working on different body positions. Maybe our feet are together, then we're going into a 2-point, and then you're bent over at a 2-point, going into a 3-point position, starting at 50%, going to 75, working from 10 yards to 15, all the way up to 25 yards, running at full speed. And then obviously linear to curvilinear to working on lateral deceleration, linear deceleration, doing into agility drills. So this really has a lot of different things that we can broaden out to. But then the main thing is keeping all movements done below a 4 out of 10 pain scale. And that'll be talked about at the beginning of every single session, like pounding that into their head, like this, we are not to push things, because if we re-injure it, then we're setting ourselves back up even more. So I'd rather take a nice slow progression and let this go on for a little bit longer compared to trying to really push the pace of it, and then we end up back at square one. And then, so just like I was talking about before, every day starts out with those low-level drills, warm-ups, activate the hamstrings, hip flexors, just to better assess and predict the remainder of the session. This will be followed by those general sprint-specific movements and drills that we're working on during that actual session. I'll pass it over to Garrett.
So in the previous slides, Eric gave us a great breakdown on what he considers when building out a movement progression. Here's an example of how one might quantify a return to run progression for a hamstring strain. When monitoring this athlete, you should pay attention to the mile per hour or the speed that the athlete is running, the distance that the athlete is covering, whether that's that 10 yard, that 15, or even if you're pushing it to that 20 to 25 range. And you also need to pay attention to the number of reps. We can modulate their load by either increasing the intensity of the run, so making it faster, increasing the distance they traveled, so adding more yards, or adding more reps. One potential way to understand the demand of your training is to compute a acute to chronic workload ratio. Acute to chronic workload ratios show how much different the daily load or the weekly load is compared to the previous exposures. So in this example, I multiplied the miles per hour that this athlete was performing at against the reps to get an abstract load. And then I tracked the increase of that abstract load over time, making sure that it fell between a 0.8 and a 1.4 ratio. Ideally, that 0.8 to 1.4 is the sweet spot for the acute to chronic workload ratio. We know that this athlete is getting an adequate progression if the acute to chronic workload ratio drops below 0.8. We know that the athlete is being underloaded during the progression. And if the acute to chronic workload ratio is above 1.4, we know that the increase of intensity or volume was too much. This helps the progression be a little bit more linear and fit together like a puzzle. Eric will now run us through the movement progression he created for some hamstring strains.
Perfect. So phase one of it, right? Just like we talked earlier, the warm-ups, going to do those lengthening exercises that Tyler had. Maybe you can have some sliders, do some slider hamstring curls, alternate back and forth, butt down, butt up, some hip flexor stretches, strengthening exercises, just anything that's going to get the hamstrings, quads, core all warmed up and ready to go. Then we're going to start going into like A marches, A triple extension, even potentially high knee running. And all of this is subjective. So one of the things that's not on here that I like to talk with our athletes about is different gears. So let's say gear one is where they're only lifting their knee and getting their foot up off the ground, maybe 6 inches. Right, so they're doing their A marches, but their foot is barely coming off the ground. That's as far as they're comfortable getting because of their hamstring. So that's where we're going to stay at for this first day. Maybe there's gear two where now we're getting a foot off the ground, right? We're getting closer to parallel, but not quite there. And then gear three would be all the way getting full extension and being comfortable in those full ranges of motion. So first, we're going to make sure we're trying to get those type of things down. Before we really start pushing any sort of intensity. So after we get past those warm-ups, the same kind of thing goes into these cycle drills, right? In our cycle skips or B skips, that cycling action could be very shallow, like maybe just around the ankle, potentially getting up around the calf before they get around doing those full skips around the knee. So that's one way where I know these are already basic drills that you can tone back if they're going at 50%, but they might not be able to do the full cycle right away, which is totally fine because we just want to get this workload volume up then we can still work that hamstring, getting those smaller circles around the calves, around the ankles, right? We just got to get a bunch of reps in, which is fine. They got all day. That, especially our case study, they had nothing to do besides get their hamstring healthy and try to get before they got back to their team. So the main goal of that cyclical running, skipping, is we're trying to focus on hitting down underneath our hips, pulling those heels up underneath the butt, and not overstriding. Now we'll get into the step 2 of where we actually start into our relative, basically jogging progression here. So it's going to be the 10 by 10, where initially we're just going to start in an easy 2-point stance, standing straight up. You're going to have 20 yards marked off with cones. They're going to accelerate for the first 10 yards. Once they get through 10, they're going to coast, jog the rest of the 10 yards. Right when they get through that full 20, they're going to turn around and come right back. So there is no rest in between these 10 reps, but there will be a significant amount of rest in between their sets, whether that be 2, 3, 4, 5 minutes, depending on their speed and their distance. And just to go off of all of these accelerations, these initial phases, I'm not expecting these accelerations to be more than 50%. And the main thing we talk about prior to these 10 by 10 starting up is to settle in on a speed and accumulate that load over time. We're not trying to overdo it by increasing our speed every single rep, because that's like, you may feel confident, the athlete might feel confident at 50%. Like, all right, let me go a little bit faster. And then all of a sudden they push it to 75% when they're not ready for it. And that's when we get that re-injury again. So we really want to just work on that volume accumulation and settle in on a speed that we can build over days, not reps. And as we get into these next phases, right? I'll go back to step 3. Again, now we're just increasing the volume, right? Our accelerations, maybe they're going from 50 to 60%. But right now, the main focus is just accumulating load, right? We're trying to get that hamstring from being afraid and not wanting to do anything and being shut down for a few days, where now all of a sudden we're getting atrophy. So now we got to increase that volume back up with that hamstring. So still doing all the same basic warm-ups, cycle skips, the runs, but now we're going into those 5 to 7 sets. Then after that, now we're going to start adding in distance. So once we can comfortably hit 5 to 7 sets at that 50 to 75% range, okay, now we're going to start adding into 3 sets of 6 by 15 yards and then 5 by 20 yards. These accelerations we're looking to get up to that 75% speed. So when I say 75, right, I'm not asking them to get up to 75% instantly. It is a gradual 75. So maybe the first time that they feel comfortable getting to 75, it is right as they're crossing the 10-yard line, and then they're coasting it out the last 10. All right, so that's another way that I'm looking at increasing the intensity of each session with having them, all right, instead of at step 6, you're at 75%. Can we get at step 5? Can we get it at step 4? Or can I have them switch? So say the injured leg is their right leg, right? Can I see if they can get by their second step to 50 or 75% compared to starting with their non-injured leg where they can get a better push off initially. So changing up their starting position in order to get them up to that 75%, or changing their angle, which go over in step 5, where now it's a low falling start. So they start tall, feet together, fall into that acceleration. Or are they in a push-up start position, chest on the ground? Or if it's an athlete that needs to get ready for a 40-yard dash, right? Now we got to get them into a 3-point stance. Around this time, with that 6 to 15 day post-injury, depending on where the injury is, if it's a re-injury, just all those different aspects that Tyler spoke about earlier, we can decide on where we're at here. And then, yeah, so these speeds now, once we're starting to change the angles, should be around that 75 to 90%. And once we start to get comfortable at being at that 75% and we can start pushing a little past, this is where I want to start incorporating those low level deceleration and change of direction work. Now, prior to this, you can work on the basic fundamentals of decel and change direction at like very low intensities, but I don't want to incorporate any of that stuff too early just because we want to get back into running like 75, 90, 100% before we work into that deceleration. But these can be your lateral decels where we're doing box drills. With in this instance with our NFL athletes, these can be going into like pass drops, into shuffling, into like where it's a route on air. So they're just playing defense on an imaginary route, and then there's a quarterback throwing an interception to them. And then once we get into step 6, or between 1 to 3 weeks post injury, ideally, now we're hitting those max speeds, and this is where your rest intervals really play a part. Right? If you're giving them 1 minute rest in between these 4 sets of 25-yard sprints, where it's 25-yard sprint as hard as they can go, jog for 25, and then turn it right back around, you're going to really strain that hamstring and not give it adequate rest time in order to be at where we want it to be. We want it to be able to sprint at 100%. And if it's fatigued, it's not going to be at 100%, and we're not going to get the adaptation that we're looking for here with these runs. So those are going to be the main points that we're looking at while we're doing all of this. And just one side note that we had the ability to do because we had max velocity sprint numbers on our athlete is we timed them. So you can have timing gates, you could use a stopwatch, whatever you need to do, or if you are lucky enough, you have GPS units where you can get actual miles per hour. So we had his flying 10 numbers, we had his 0 to 10 numbers. So I had what his peak ever was. And during all of these at 50, at 60, at 75, at 90%, I was able to calculate like where he was at. So when he was doing his 10 by 10 runs and he was telling me, yeah, I feel like this is about 75%, I was able to quantify that number when we were recording and taking his time. So he's going between gates, right? Setting up timing gates, running back and forth. So I'm able to get those numbers and relay back to Garrett and Tyler, like, hey, yeah, he's actually at 75%. Hey, he's actually at 90% today. Things felt really good. So those are easy ways. If you have their 0 to 10 numbers, if you have their max velocity numbers, then you have a very easy way to quantify what percentage they're actually at right now.
So after completing a comprehensive rehab program, we are now ready to kind of view like the results of the last 4 weeks of work. These graphs are updated strength numbers from our case study. In just over 3 weeks, we were able to increase his quad symmetry to 99%, along with increasing his quad relative strength to over 100% bilaterally. Our goals were above 90% for both symmetry and relative strength, so this athlete gets 3 check marks. The hamstring symmetry increased to 88%, in a mere 3 weeks. There is still work to have done, as we have the hamstring as we want the hamstring symmetry, upwards of 90%. However, given the timeline, we really felt like this strength adaptation was adequate to continue his return to play at training camp. Ultimately, we test to inform our loading progression, and we can continue to move. We can continue movement progressions as tolerated, while we are modeling strength blocks to create the adaptation that we are looking for. In this scenario, we will continue to overload the right hammy. However, the ratio will not be a 4 to 1 anymore. It will likely be a 4 to 3 ratio. For this athlete, we tracked his strength, running progression, and even his counter movement jump. And on the next slide, we'll discuss a few adaptations seen in his counter movement jump.
So we were able to track a lot a lot of different data points with this individual. One of the most common things that you'll see in the sports performance and rehab space is a counter movement jump. And depending on the context of situation, some variables are more meaningful than others. For example, in the performance world, takeoff velocity or relative peak power may be a more influential metric than looking at percent off shift, which tends to be a more rehab oriented or injury risk metric. When analyzing this athlete's data in reference to hamstring strains, counter movement jumps historically are not the most sensitive to this type of information. However, one thing that we are paying attention to is this athlete's ability to eccentrically push force into the ground during the loading phase. Some research shows that increased eccentric force production means that an athlete is healthier and is at less risk for lower extremity injury in general. In this example, we were able to increase this athlete's braking force or eccentric force by around 14% on that involved side, indicating that the lower extremity is now at less risk for injury compared to previously. This number does not mitigate any injury risk, however. It does provide insight into the athlete's adaptation from the strength program that was periodized by Tyler and Eric. Overall, this athlete made considerable progress in a month, and we will continue to monitor and track his progress to modulate any training as necessary. Tracking athlete data can be simple and complex, so find the tools that you have access to and create a framework that is meaningful and reproducible. The more you test and evaluate your athlete, the more you can base their strength and conditioning programming off those specific metrics. In conclusion, we want to thank Training House, TCO, and the Minnesota Athletic Trainers Association for this opportunity to speak with you guys tonight. If you have any questions, please feel free to reach out to us. Our emails are on the screen. We'd be more than happy to give you guys any resources that you need.
Awesome. Thank you, Tyler, Eric, and Garrett. It was a great talk on hamstrings. For everybody listening, you will be receiving an email here shortly with regards to your post-assessment quiz as well as post-assessment evaluations. Once those are completed, you will receive your CEU certificate. As always, this is a member add-on benefit to our Minnesota Athletic Trainers Association members. And we do ask that in lieu of the registration that you get with that, that you consider donating to our political action fund to help us as we continue to work on updating and modernizing our Scope of Practice and Licensure Act. Our next Sip and Study Survey will be on Sunday, October 5th at 7 p.m., where we will be discussing wrestling basics. Hello, everyone. I want to welcome you to the Fall/September 2025 Sip and Study Soiree. Tonight's presentation on fall sports readiness, prevention, policy, and preparedness will be presented by Blaine Bertzer. He is a doctor of athletic training at Hamline University. He's also an assistant athletic trainer and adjunct professor for Hamline, as well as an adjunct professor for Winona State University. Prior to getting his Doctors of Athletic Training from Indiana State University, Blaine obtained his Bachelor's of Science in Athletic Training and Kinesiology at the University of North Dakota. Blaine, take it away.
Awesome. Thank you very much. And thank you to Matta again for continuing to allow me to do these. I get a great deal of satisfaction out of being able to share some of my experience and my knowledge. So thank you guys as well. As the introduction said, I am going to go over some fall sports readiness, going over a little bit of kind of what I end up doing when it comes to preparing for fall athletics, which really just does feel like preparing for the entire year, and hopefully giving you guys some information that you guys can take out of this that's beneficial, or at the very least, you get to see a kind of awkward photo collage of pictures from sidelines of sports that I've been at. So to begin, I have no financial relationships to disclose. I've got nothing going on there. With a talk like this, it's kind of interesting. I'm usually talking about actual topics, and this time I'm kind of like in the spring getting asked to more or less just talk about my own experience with things. And so the agenda for this does feel a little bit odd and a little bit less dense than it usually is. thanks to the introduction. I don't have to do as much with an introduction for me, but I'll basically be going over preparing for fall, what I end up doing, a little bit with emergency planning, which just kind of all feels like admin stuff. And then I was asked to touch a little bit on fall weather and just weather policy, just because that is an area that I end up doing a lot of work in. And you'll see this photo on the right here is one where there is a ton of snow that is present. And that was actually my 8th day working at Hamlin back in October 20th of 2020. We had a snowstorm dump about 5 inches of snow, and fall really does kind of encompass a little bit of everything from a planning standpoint to a weather standpoint. And so hopefully you will find something out of this presentation that is of use and beneficial. As the introduction kind of alluded to, my name is Blaine. I was born and raised just south of Eau Claire, went on to the University of North Dakota to get my bachelor's in athletic training and kinesiology. Was fortunate enough to be part of the 3rd cohort for Indiana State University's DAT program. And then after some time spent working in Manitowoc, was hired by Twin City Orthopedics to work at Hamlin University as an athletic trainer there, working originally with a whole host of teams, but now if we kind of tone things down a little bit, so I'm with men's soccer, men and women's swim and dive, women's basketball, and baseball. So after about a year working at Hamlin, I was fortunate enough to have them offer to have me teach there. And so I've been teaching there ever since right around 2021. And then as of this fall, while still getting to practice clinically and still teaching at Hamlin in their exercise science and biology departments, Winona State University is allowing me to teach in their master's program, which feels a little bit like a fever dream, but I'm very appreciative and happy for all the opportunities I've gotten. Like I said, with this, fall is kind of an interesting time. And for me, it really isn't just preparing for fall sports. It's kind of just preparing for fall. I think a more creative way to have done this would have been just to cross out everything as far as fall sports goes and then just put everything above it, because this is, for most athletic trainers working in the traditional setting, and I'm working in a traditional D3 setting, this is the start to our year. It's the start to the academic year. It's the start to the athletic year. This is what I consider to be the start of the year for my job. And so with this, I don't necessarily get maybe the benefit of preparing for spring sports like I do for baseball, where it's very much just a lot of one-on-one and preparing specific rehab plans. There are a lot more tasks that go into preparing for fall and fall sports, and it really does feel like a lot of admin work. And so my hope out of this is that I can not necessarily show you that admin work is fantastic, because I think all of us would struggle to believe that, but at least show you that some of the admin items that we at least do at Hamlin and a lot of athletic trainers do throughout the profession are incredibly beneficial and can really make for an opportunity to start out on the right foot. And so the way that I logically have broken this up is I'm going to start with some annual review items. And for me, most of my annual review items, whether they are checklist items that I actually have to mark off as part of my role being an athletic trainer for an NCAA institution, or just me personally, really it just involves me kind of getting back into the swing of things a little bit. So I'm very fortunate. I get a couple months off in the summer where I get to kind of lower my patient load. And most of the care that I do between June and July is just one-on-one patient care. And because of that, a lot of my acute care skills and my emergency skills and some of those things do kind of fall to the wayside. And I wouldn't say I necessarily get bad at them, but there is a period of time where I kind of feel like I don't not necessarily know what I'm doing, but I'm not nearly as well versed as I was. And so a lot of my annual review items, or at least the ones that are expected of me, are reviewing those skills. And I've got a lot of opportunities to do that, which is nice. I'm very fortunate working at Twin City Orthopedics that we put together a sports medicine sideline conference. I'm actually on the committee for that, which is really my first opportunity to begin reviewing some of my skills. And also for me, typically marks the end of my summer. And that's right around the 2nd or 3rd week of July. And so with that, we go, all of it is very much acute based, sideline based overall. And we do spine boarding, even with some of the changes. We bring in EMS to kind of go over those changes and how we're going to implement that within the Twin Cities Metro. We go over, a lot of different topics. So we went over shoulder relocations, wound care, a bunch of different items that are all kind of reviewing those acute care skills, those emergency skills, and is really just a good opportunity to start off my fall on a good foot by just getting to see some of the individuals that I don't get to see that often that I work with. We'll then continue that with, at the beginning of August, doing some SMA onboarding. These are our students. And this is another opportunity for not only me as an athletic trainer to practice some of my skills, but also to practice them to the extent which I'm teaching them to other individuals. We're going to teach our SMAs a whole host of taping skills. We're going to teach them essentially our EAPs, and we're going to run through our EAPs with them. We're teaching them wrapping skills. We're going over a lot of different medical skills. In some cases, depending upon where they're at in their CPR certification, I'll certify them in CPR. This is giving me a ton of different opportunities to not only practice my skills, but practice it to a degree in which I'm teaching it, which is really nice. And then we'll do other in-services, which I think a lot of, ATs, especially ones that work as part of a on-site sports medicine healthcare team, I think a lot of them get the opportunity to do the in-services as well. Just sitting and meeting, getting schedules set, and getting everything put together so that we're in a good spot going into August, and really just making sure that we are ready to go by right around the middle of August when sports start up for us. We do have an obligation as an NCAA school to do some annual review items for coaching and staff. A lot of these items are coming from the concussion safety protocol checklist, and then also the preventing catastrophic injury and death in collegiate athletes kind of checklist and that research. And I really try not to think of these, and we really try not to treat these as these checklist items, but more so an opportunity to begin those conversations with our coaches, especially the ones that we maybe haven't been working with as long, new coaches for the year. It's a touch point for us to get to know those individuals and to kind of set the expectations, as well as getting a shared understanding of what kind of the safety aspect of not only fall sports, but all the sports throughout the year is going to look like. So we're going to go through those concussion safety protocol checklist items. We're going to make sure that coaches have been educated on those items. We're going to make sure that the athletics director has been educated on those items as well. We're going to review policies and procedures. We put a little bit of emphasis on policies that tend to provide a little bit of contention overall. So we're going to review that concussion policy because that's an expectation, but we really do spend a lot of time reviewing weather policies because weather does tend to strike at the most inconvenient of times. Coming off of a lightning delay for practices today, I can honestly say that the response that we're getting from the coaches with each year of us doing this has been more and more positive. And while they might get frustrated, they're not necessarily mad at the situation. And then we're going to review EAPs and catastrophic injury prevention. We're going to talk about sickling. We're going to talk about exertional heat stroke. We're going to talk about these essentially items in which by addressing them, we're preventing that catastrophic injury and death. And we're not really trying to do this in a way in which we're just checking off boxes on a checklist. We're really trying to get coaches involved and make that a meaningful discussion. We even went so far as this year we had TCO come in and we kind of put together a workshop to facilitate better relationships within sports medicine and athletics to try and get us all swimming in the right direction. Not necessarily because we had to and because relationships were bad, but because we really did want to make sure that the entire athletics department within Hamlin is all moving in the same direction. And that is one of doing what is best for our patients, doing what's best for athletes, and then also really supporting them in their pursuit to achieve, their goals, whether it's, individual goals within their sport or team goals. And then we move on to individual meetings. And again, a lot of these are admin stuff, but this is an opportunity for me to sit with, specifically in the fall, my soccer coach, go over what our EAP looks like for that, and then go over individual EAPs for individuals that have specific conditions that would kind of necessitate that. Gives me those touch points. I get to catch up with my coach and see how everything was over the summer. I actually had a new men's soccer coach this year, and so that was a little bit different of a conversation, but with baseball and women's basketball, I got to sit and have those conversations, see how everybody's doing, and kind of kind of spark those relationships and get things going in a positive direction as we get into the school year and we get moving forward with everything. From there, we also have athlete expectations. And for anybody who works for an NCAA institution, you know that there are a ton of things that these athletes are required to do each year outside of athletic training and outside of sports medicine and also within. And so I'm going to start with baseline testing because while this isn't necessarily the most exciting thing or the most, I don't want to say beneficial, but the most crazy thing that we do, this is something that gives us kind of these unique secondary opportunities. And so we do annual concussion baselines, we do VOMs and BESS. We're currently in a strategic planning process of maybe moving away from doing those independently and doing something else. But this is our opportunity to have some one-on-one time with patients that are new, some one-on-one time with athletes that we haven't met before. And this just serves as a really crucial touch point for us. It allows every athlete that comes to Hamlin, because they're doing this baseline with us in the AT room, it allows every one of them to know where the AT room is, and every one of them gets the opportunity to meet their athletic trainer before their season starts. And with it being VOMs and BESS, it is massively time consuming. And if we could probably cut the time components of that out a little bit and keep the one-on-one stuff, I think that we would, and that's kind of what we're exploring now. But it is a really beneficial time for us. And it also gives us this ability to begin that screening process for, are there issues that we need to address with these individuals? So with VOMs and BESS, if we do have some significant issues, we do have hard cutoffs for red flags for these individuals and for us to actually go and to refer these individuals if need be. And that leads us into kind of the bigger aspect of this, and these are our annual forms and physicals. As boring as these items can be, sitting down and going through them and really taking the time to go through them has probably been one of the most beneficial things for me in my clinical practice at Hamlin, and probably one of the things that I admire about our staff as a whole the most is how much time we spend getting to know the medical history of our athletes and how we use that information as well. We have an annual health questionnaire that we put together that the athletes have to fill out each year that goes well above and beyond what the NCAA requires. We're asking for substance abuse screenings. We've talked about throwing in some other things just based on the patient populations that we work with. And between that and then the physicals for our first year students, this is really a window into the athlete for the year before they even make it to campus. We get to look at pre-existing conditions, acute issues, meds that they're taking, and through all of those things, throwing a new set of eyes on them, potentially putting us in a situation in which we can really make a positive change for those individuals. And that's probably the thing I'm most proud about with how we've addressed this in the past is we have a pretty solid history of having individuals coming in with pre-existing conditions that all of a sudden, because it's a new set of eyes on it, we know who to refer them to, and those conditions are rectified, they're solved. Individuals who are coming in with meds that, while we're not the ones that are obviously going to change that prescription or even recommend it, we can recognize that something's wrong and then go get those meds changed, or at least send them to an individual that can get them on better medication. And the amount of success stories we have with that is really something that's been something that I've really been personally proud of for all of us on our staff because of how well we do with that. It also gives us an opportunity to look at their insurance as college students. For a lot of them, most of them really, this is the first time that they're out on their own with kind of their own insurance issues. Maybe they don't have their own insurance, they have their parents, but they're definitely going to have to be the ones that deal with this. And my big question is, will their insurance do anything in the state of Minnesota? And not to talk poorly about anything, but if I see an individual that's going to be working with me and I see that they've got Kaiser insurance, I'm going to recommend that they get our school-sponsored insurance plan, specifically because Kaiser will not really do anything in the state of Minnesota, and there's nothing that is sadder than an individual having to go back home to get the care that they need because they can't afford it here. And while we do have a secondary insurance policy at Hamlin, it really only works for athletic stuff, and I really like to have them covered. So it gives me an opportunity to talk with them about that and potentially improve it. And we really just use this information to screen. And we all do this slightly differently, but on my end, I've got red flags, which are, hey, this needs to be immediately addressed before you're allowed to do anything. Yellow flags where, hey, this might be a red flag or this might just be a miscommunication, but we're going to schedule a discussion to figure it out. These discussions, we've got plenty of opportunities on the annual health questionnaire and their physicals for them to ask us questions or request to set up meetings with us before the year has even started, in which, yep, you're going to be good to go, but I want to discuss it. And then other things in which we're just noting things. So, oh, they've got an injury that they've had in the past. It's no longer a problem. We're going to note those. And by having all of these things kind of readily available and reviewing all of them, not only does it paint us a really good holistic picture of the athlete's health and well-being coming in, obviously depending upon how accurate they fill out some of these forms, but it also puts us in a position in which we know a little bit more about them. I know most of my men's soccer players' medical histories before I meet them when they're first coming here. And it's kind of a weird thing to say, but it does put me in a really good spot to be able to provide them the best possible care that I can as soon as possible. And that's just kind of one of the better parts of this, even though as from a task standpoint, the admin part of it is pretty grueling overall. And then get into kind of just my own personal review items. And this is just stuff that I have to do. And this is probably the least exciting out of anything that I've talked about so far. And we've talked about a lot of admin stuff. This is just stuff that I need to do at the beginning of the year. That's not necessarily expected of me, though it kind of is. but it's mainly just me getting ready for things. And so with this, med kit packing is a huge one. And unlike with baseball, like I kind of did the sip and swallow thing in the spring where I was talking about packing for baseball. Mainly I'm just restocking. I leave my kit in pretty bad shape over the summer because I don't use it much. Like I work at gymnastics camp right out of my AT room, and then I go and work at USA Soccer, and they supply everything for that tournament. I don't really have to worry about that. My kit's in pretty bad shape, so I'm going to restock that. I'm going to pack for soccer. Unlike with baseball, where we've got some kind of crazy things that we bring with, soccer is much more straightforward from like a rehab side of things, and I really appreciate that about them. I can bring a lot more variety of a lot simpler items. A lot of different bands. We've got cones. We've got things for agility. All of those things we can pack into the kit and put myself in a better spot without necessarily needing some of the weird gadgets that I've had for baseball in the past. And then the big one is insurance info, making sure that all of that stuff is readily available in my kit so that if somebody needs to go somewhere, I've got the ability to send them there. We're also going to do travel kits. I'm going to make a separate travel kit for my soccer team, but I'm also going to make that for all of my teams because not only are they checking those out for travel, they're also checking those kits out for any other non-traditional practices, open gyms, coaches practice, or not coaches practices, captains practices, anything of that nature, just so they've got basically a first aid kit there. And so with that, we're stocking one for each team. We're going through, and along with, you know, all the specific stuff that I'm doing for soccer, we're making sure that those same kind of steps are taken for women's basketball and their kit, and making sure that with their kit, I'm supplying it with things that they tend to use a little bit more of. We're throwing in some extra pre-wrap. We're throwing in some hair ties. We're throwing in some other items for them. Or baseball, throwing in a ton of finger tape because they burn through that stuff like crazy. And so just making sure that those kits are stocked and checked out to coaches, and we've got everything set up there. I'm also going to begin kind of reviewing more of the knowledge side of things. So I've already talked about some of the skills planning and skills review that I've been doing. Now we're just kind of reviewing things to get me put in a good spot so that I'm in a spot in which I can adequately and kind of accurately relay and convey information. So for me, I'm going to review some policy literature. I'm just going to make sure I go over our policies, whether it's at Hamlin or within the MIAC as a conference and within the NCAA as a larger institution. I'm going to just kind of briefly read that. I might go through some of the documents that are going to inform those policy decisions. I'll look for new ones, but really the big thing that I'm going to do before the beginning of the year is over the course of the year, I have PubMed alert results that get sent to me pretty much every week on different topics that I have kind of searched out there. So we can see this email is actually from today because I had the opportunity to update it. So this is just my one that I have sent out for ankle sprains. And so what it'll do is it'll send a little email to me, and then it's got a list of all of the ankle sprain items or anything that meets my search quota, items that have been released over the last month or however long it is. I'm going to collect those kind of all year, and then I read them when it makes sense. So for me, right now, going into a soccer season, any of the soccer kind of research feelers that I have sent out there, any ones about ankle injuries, knee injuries that are specifically looking at field sports, those are going to be the things that I read. And this isn't going to be me sitting down and reading for 6 to 8 hours a day. It's going to be, hey, it's Sunday morning. I've got a cup of coffee. It's nice outside. I'm going to sit outside and read a couple research articles. And that's probably the extent of my actual prep on my end, and really just kind of completing those annual items. You can move into emergency planning, and I don't know really what I thought this one would be when I kind of put it together, but it really does get a little bit, I don't know, it's pretty simple, pretty straightforward. For emergency action planning, I'm going to go through our EAPs. I'm going to update contact info. I'm going to update any site information if there have been any changes. And then the other thing that I'm going to do is I'm going to review the EAP. And we're going to compare it against any recent research that's come out. We just had that consensus statement that came out in 2024. Not a lot of really strong consensus coming out of a lot of the topics within that particular article, but it does give me things that I can change with ours. And we're going to update all of those sheets, and we're going to make them something that works really, really well. Along with that, and kind of simultaneously, I'm going to update the visiting team info. We're going to update game day schedule based on how everything last year went, update some of the resources that are provided if we have more or less, update contact info again, and then again reviewing that info. And what I'm basically doing is just confirming that everything in these reports are still accurate. Hospital locations, hospital addresses, pharmacy locations, all of the information that I include in these is still accurate and is still adequate. And then also on the EAP side of things, that the EAP still works in an effective way and is still an effective thing that we have. And so it is just really just kind of diving in and reviewing those items. And then also not only just reviewing them amongst myself and kind of mentally rehearsing them, but working on them with our SMAs and our other individuals that are going to be working on these policies and these action plans with us. I do the same thing for individual EAPs. This is something that I started once I started having individuals that would necessitate this. I've really de-identified all of this on this sheet over here. I've taken the name off and everything, but typically based on those screening questions that we have, I'm going to develop individual EAPs based on the specific condition that individual has. With that, I really want that to be a collaborative process. And so I'm going to meet with that individual and I'm going to customize that plan and treatment for that sheet based on what they say. So we're going to go in, the example here is they've got sickle cell trait. We're going to go through, add all of their medical information, whatever emergency contacts they want, their insurance information. And then when we get to sign and symptoms, I'm going to ask them, hey, have you ever had symptoms of this previously? Has this ever happened to you before? Do you know when that is kind of coming on? Do you know when it's happening? Or is this something that you've never had happen before and you kind of incidentally found that out? I'll do that with sickle cell. I'll do that with diabetes. I'll do that with any condition that necessitates that. And then I'll customize their treatment based on, more or less if they've had success with things in the past, or if we're just doing based on best practices. And so all of that will be on one document. It's a front and back page. The front page just kind of goes over the individual and signs and symptoms, and the back page is the specific treatment plan for that individual. I'm going to make sure that they have a copy of that. There's a copy in my med kit at all times, and then there's a copy in the travel kit, as well as forwarding that to any athletic trainers that are going to be working with those individuals when my team travels if I'm not with them. And that's just a nice way to make sure that we're kind of covering for that individual. We're making sure that we're providing them the best care possible, and also putting them in a situation in which they feel safe and they feel like they're being taken care of, which is huge. And from kind of an admin and prepping for the season standpoint, that really is kind of it. And we're not just doing this for soccer, and I'm not just doing this for fall sports. We're doing this for pretty much everybody. By the time soccer starts right around the middle of August, as they're going through their two-a-days, I'm going to be doing this process for women's basketball. I'm going to be doing this process for baseball because they'll be showing up 2 weeks later. So I'm going to make sure that all of those things are more or less happening and that we're getting everything taken care of in a meaningful way. Oh, excuse me. So then I get to talk a little bit about weather, which is something that I've talked a lot about for a lot of different people. This is one of my more common presentations. I really don't want this to feel like a continuation or a rehashing of all of the information from the MATA Symposium this year. And so I'm going to try to make this a little bit different, or at least a little bit more, excuse me, a little bit more relevant, at least to fall weather, or sorry, I just had to take a drink. More relevant to fall, and then all the things that they're doing there. Ooh, all right, excuse me. So we'll start with heat. This is actually from August a few years back. We can see that out on our turf field at Hamlin, we're in well within kind of the black range of our essentially weather policy. We actually top out at about 86.1 for most sports, with a few other sports going up to 87.1, specifically with baseball, softball, and tennis. But this is something that happens pretty common for us, especially when it comes to August and September, as we get a lot of days where things are incredibly hot. And coming off of 2 weeks of unseasonably cold temperatures, I'm pretty thankful for that, because the heat policy stuff I actually think is probably some of the most frustrating for coaches, only because it does really feel like these individuals are kind of, I don't know, coaches tend to feel like this is one of those things that's a little bit more intense, even though we know very well, especially for some recent things that are happening, that this is something that is really, really important. And so with heat, again, I'm going to try to make this not exactly like the MATA one. And so we've updated this a little bit, and we're going to make this a little bit more of a review overall. But heat deaths, we do see that there are a lot of them that occur each year, and we do a really, really awful job of not only counting heat deaths, but also specifying between kind of this metabolic and exertional heat illness, and then just this passive heat stroke that individuals can suffer from. And so we can see that we've got a lot of different heat deaths here, 21,500 from 99 to 2023, and 2,300 in 2023 alone. But that doesn't really specify what those are. All of that aside, we still know that exertional heat stroke is one of the top 3 causes of sudden death in athletes, and this happens every year. It's not something that is relatively unique to anywhere in the country, though we do tend to see it more in the South. This is something that happens all the time. Back in July, we had an individual who was 16 who died from heat stroke. He was a high school football player. We just had the cross-country athlete who was found 4 hours after a practice started in a field in Kansas because they were running when it was 101 degrees out. We can see these things constantly happening. And because of that, we do have the backing of a lot of policies that maybe I didn't have when I started in my athletic training career. And this does really provide us with some benefits, but we really do have to enforce these things and be kind of swimming in the same direction as athletic trainers. Just a brief review, our exertional heat exhaustion. This is basically our inability to effectively continue exercise. We want to catch individuals when they are here. We used to have this continuum of heat stroke through exertional heat exhaustion, or essentially heat cramps, exertional heat exhaustion, and heat stroke. And these are really the only 2 that we need to care about at this point in time. Exertional heat exhaustion, where if we can catch individuals here, we can not only prevent exertional heat stroke, but some of the sequelae and some of the susceptibility to heat stroke in the future. And then obviously heat stroke. And you can see through research, there are a number of different organizations and a number of different things that might provide more symptoms than this. But when it comes to the best practice guidelines, the 2 symptoms you're looking for, central nervous system dysfunction and a core body temperature above 105 degrees Fahrenheit. That is really the big thing that we're looking for here. I put an asterisk next to this because depending upon the organization, it will be as low as 104. Some will say 104.5. You're going to use your clinical judgment. If you see an individual at 104 core body temp and they've got central nervous system dysfunction, especially obvious central nervous system dysfunction, you're going to treat that individual as though they have heat stroke. When it comes to heat illness management, you guys have heard this 1,000 times. Cool first, transport second. First thing we're going to do, we're going to assess vitals. We're going to make sure that we're not missing anything that could potentially put these individuals in a place in which the heat stroke is not the immediate concern. We're going to check airway, we're going to check breathing, we're going to check circulation, we're going to check central nervous system stuff. And if they are stable, but you are suspecting them of having heat stroke, we are going to assess that core body temperature. Rectal temp is gold standard, and I'm going to use, I think, the best analogy or best comparison that I possibly can, and that is comparing an AED and a rectal thermometer. An AED is a diagnostic tool that also provides a treatment, whereas a rectal thermometer is just a diagnostic tool. Both of them, though, are crucial to identifying and managing life-threatening illnesses. And the only difference between a rectal thermometer accurately diagnosing an individual with heat stroke and an AED diagnosing an individual with cardiac arrest and then correcting the rhythm is that for the rectal thermometer, you have to do the second part. You have to go and correct the core body temperature. Without that core body temp, you cannot rule out rhabdo. You cannot rule out sickling. Those symptoms for those conditions can present in much the same way. And without our ability to rule those conditions out, we do not know if we're doing the best course of treatment. Each one of these conditions requires a different treatment. And because of that, we really do need that piece of information. And if you were ever in a situation where you suspected an individual of having cardiac arrest, you would never hesitate to do whatever it took to get the AED on that individual, because the AED is also a gold standard in pre-hospital care of suspected cardiac arrest. And that's really my soapbox on that. You're going to do rapid cooling. Ice water immersion is the gold standard. Taco method is acceptable. Our goal here is to get the core body temp below 102 within 30 minutes of symptom onset. I worked the USA Cup this summer. We did this. We had an individual who came in from a cooler part of the world, came in. It was quite hot during the USA Cup, and we had to dunk them until their core body temperature got below it. This is something that is best practice. And as long as you do this, core body temp below 102 within 30 minutes, the chance of survival is 100%. And I've got a suggested reading at the end of this article that shows the amount of heat stroke cases at a road race, and all of them had positive results because they were treated this way. Make sure that you have one of these. And also, if you have one of these, cold water immersion or the taco method, make sure that you have it set up when appropriate. This is where policies and procedures and making sure that you have those conversations with administration and with your coaches can be beneficial. There's no benefit to having a cold tub or a cold water immersion tub if you do not have it full with water and ice when these situations occur. It's wasted time that we don't need. So taco method, inflatable pool, cow trough, any of those things, all of them are fantastic. And then you're going to transport to hospital for follow-up care. We're monitoring for any potential sequelae or conditions that pop up afterwards. And then we've got a return to sport that's going to range from 7 days to 1 month, depending upon what you look at. There is no standard here. And so making sure that you have those discussions and are a little bit informed with it, should that happen, is going to be important. That 1+ month, that's actually the U.S. military. They do not let you do PT for a month after a confirmed heat stroke case. It's pretty crazy. I'm not going to dive into all of this because it's a lot of info here, but this is where those intrinsic factors that make you more likely to suffer from exertional heat illness, this is where we can catch some of these things through our looking at annual health questionnaires and physicals. We can potentially look at individuals and see, hey, we've got sleeping issues. They're on certain medications. They've been injured the entire summer. They might have lower levels of physical fitness. Maybe in some of those, they've been talking about kind of what they've been doing over the summer. We've got some open-ended questions, and they've been training indoors over the summer. Now they're coming to Hamlin, and it's 95 degrees outside, and they're training outside for the first time. All of those are things that you might be able to pick up upon in those annual health questionnaires and those physicals if you have access to them. And then the extrinsic factors are really just the things that you kind of understand. For me, one of these extrinsic factors, high temperature sleeping conditions, I know if I've got a freshman coming to Hamlin and they're staying in the dorms, if it's hot outside at night, this is what they're dealing with. We don't have air conditioning. So I'm going to know that that's going to potentially impact that individual's ability to recover from hot and humid temperatures. So with those hot weather considerations, wet bulb globe temperature is probably going to be one of the best tools that we have. And you've got a bunch of different ways to do it. If you've got Perry and you've got apps that kind of calculate that, that's fine, especially if you can't afford a Kestrel. But having that kind of local wet bulb globe temperature or wet bulb globe thermometer is fantastic. And it does make for a much more accurate measurement. The only thing that I will say is that despite the fact that wet bulb globe temperature is kind of our gold standard overall for maybe assessing heat stress on the body, it does have some limitations. And the biggest one really is humidity. And so if you've got an individual, you've got a wet bulb of maybe 81, we're well within kind of this yellow zone, maybe not well within it, but we're within kind of this yellow practice guidelines that we have at Hamlin. But the humidity is like 90%. That's going to provide a significantly higher heat stress on a human body than an individual that's dealing with 90-degree wet bulb globe temperatures, but the humidity is relatively low. We're sitting maybe down at 40, maybe 30 or 20%. We're doing Arizona heat. And so this is where maybe you're not building that into the policy because it gets a little bit more nuanced, but it is something that you can provide some context with. And this is where your own expertise as a medical provider that has to, play weatherman every once in a while gets to kind of dive into. And so with that, those are just considerations to take in. Playing surface, we play on a grass field at Hamlin. We play on Pat Patterson. Because of the amount of water we put on that to make that field look nice, it actually makes our wet bulb quite a bit higher of other areas on campus just because of the amount of humidity coming off of the field itself. Access to cool spaces, athletic activity, age of participants, staffing and resources, impact of additional emergency scenarios should you be planning something that's a little bit larger. Maybe you're planning a conference cross-country meet or something crazy, and for whatever reason, it's incredibly warm out. What is the impact of that temperature being significantly warmer and you having more individuals that are requiring emergency care than maybe you originally had anticipated? And then time of year and level of acclimatization. So as the fall goes on, not only should that acclimatization go up and improve, but the necessity of that should go down as temperatures go down as well. Cold, as I kind of alluded to at the beginning of this entire presentation, sometimes we get snow in October in Minnesota, and that does provide us with some interesting cold weather stuff. I'm not going to dive into each cold weather injury that you can get. Your chances of getting frostbite as an individual who's practicing in the fall are pretty slim. But really, when it comes to cold weather injuries, we're going to probably be dealing with, at least in the fall, these non-freezing cold injuries from individuals who are wet and participating in cooler temperatures or hypothermia. And in both of those cases, with the exception of maybe some late season football and some playoff level soccer or something of that nature, this is typically going to involve rain. And so with this, general management always should be that warming is gradual and we're avoiding rewarming through friction or extreme temps. For our non-freezing cold injury, we've got individuals that have been exercising outside for a long period of time. It's cold, their feet are wet, we're going to clean and dry the area and slowly allow it to rewarm. For our hypothermia, we're going to prevent further cooling and initiate rewarming. Our chances of having significant hypothermia here, especially in an athletic population that we're monitoring, is pretty slim. But it's still good to know what essentially this looks like. And kind of a modern take on this is, especially if you have the equipment, you can obtain a rec temp if possible, and then compare that to what essentially the core body temperature should not get to on the low end of things. But again, realistically speaking, and this is kind of the benefit, I think, of cold weather over warm weather is one, there's not really a lot of acclimatization here. So like this level of acclimatization is pretty minimal. You don't really get better at dealing with cold. You get just more used to it. But also, and this is an anecdotal thing, you're not going to find research that says this, but if the athletes are cold outside, typically everybody else in the bench is cold as well. And so it's a little bit more, I want to say miserable for the coaching staff, but it is a little bit more miserable for the coaching staff when it is cold outside compared to warm. When it's warm outside, you've got individuals that are on the sidelines that are typically wearing less, especially on the football side of things, and they're not moving as much. And so they're able to stay a little bit, relatively cooler than the actual athletes that are out there. On the cold weather side of things, these guys are typically just as miserable as everybody else. And it's a lot easier to have kind of that relation to that weather in a more meaningful way. Conditions here, especially in the fall, it's typically going to be wind and rain. That's going to be the big ones. We're not adapting to the cold. We're not getting used to it. And so even if it goes from 90 one day to 30 the next, you're typically going to be able to handle that cold weather just as well as you would have been before. But that wind and rain is really going to be what gets us. Water is much more heat conductive. And so wet conditions, individuals who are outside in cold conditions and are sweating a lot, those individuals are going to be the ones that are at risk. Access to warm spaces, warming modalities, those big poofy jackets, if you're a football or soccer player, all of those are going to be particularly helpful. You can go, not that baseball is in season, but you can go the baseball route and have the turbo heaters on the sideline as well. All of that stuff are potential options that you have. But realistically speaking, most of us are going to recognize that this is a problem and also not necessarily be in a really bad spot here, especially in the fall until we get into maybe the end of fall season with some of these sports. And by that point in time, we've typically gotten to the point in which we're understanding what these temperatures are doing. Some interesting things that, again, you can glean from some of your medical paperwork. Hypoglycemia is going to significantly increase your risk of essentially cold weather illness, or not exertional cold illness, but just cold illness as a whole. You can also have some comorbidities that are impacted by cold temps, EIB, coronary artery disease, diabetes, mental health conditions. And so understanding how that's impacted can also make it so that maybe you're changing things based on cold weather. We do not have firm policies for cold weather that are kind of universally applied throughout the country. We have a lot of these kind of recommendations. So this is the Go for Ellis recommendation. You've got recommendations within the NCAA. We have our own policy within MIAC that's kind of following a very similar thing here. Some individuals will look at wind chill temperature. Some will look at absolute temperature. For baseball, for whatever reason in the MIAC, just because this is a different kind of example of what you can do, even though baseball's not going, we use feels like temp, which can vary based on the organization. So there's a lot of different things that you can look here for cold weather. But luckily, this isn't typically something that, at least in an athletic population of traditional athletics, we have to deal with as much. Lightning, this is a big one. This is one that I have dealt with a lot recently, at least with some of the storms a few weeks ago. And then now, these last couple of days, this is just something that kind of pops into place here all the time. This is something where in the United States, this is not a massive problem. We've got maybe 11 to 20 people. I actually don't know if the 0 deaths thus far in 2025 is true. I don't have any updated info as of this month that I could see. But like it was a low of 11 in 2021, and we have not had levels of 1943 of that 432 deaths since 1943. And that's not just because it's high. We haven't even had anything close to that. And so this is something where, because of individuals like athletic trainers and people who are taking these weather policies seriously, we're in a really good spot. You got about a 1 in 10,000 chance of being struck by lightning by age 80. It's not dying of lightning, that's just being struck. It's pretty rare overall. We can see, though, that globally, we're not as lucky. Women's soccer game ends in tragedy as 4 players killed. We had another Peruvian soccer player was essentially killed in another lightning strike. All of these happening within the last couple of years, as well as it is not impossible in the United States. So this is really the first article I've seen about an individual being struck by lightning doing formalized athletics that is involving maybe an athletic trainer. But Glacier High School soccer player remains in ICU after being hit by lightning. We got 2 soccer players and an assistant coach. And so with this, if you have a lightning policy and you aren't really abiding by that, this is a pretty precarious situation for you to be in overall. And this is where those policies and having those policies set up in a way to protect you are particularly beneficial, not only in protecting you from liability, but also protecting you from the possibility of having any pushback from your administration. Key components to a lightning safety policy, it's pretty simple overall. It's just making sure that you have one. I have continued to fight the impulse to have the little plane struck by lightning and Lightning McQueen shooting by twice here, because I do think it kind of takes away from the message. But we can see that like this stuff happens, and unfortunately, the individuals that are kind of leading this charge to taking lightning safety a little bit seriously are actually the high schools. It's the youth sports. We don't have the same level of top down with lightning policy that we do with other things, especially professional sports, where this can happen. This was at a Phillies game. So with lightning safety, it's just making sure that you have a set policy. You can go and do safety slogans. This is something that's recommended, and especially NOAA and the National Weather Service recommended as a whole. But really, the big thing is going to be establishing a chain of command. Athletic trainers should have unquestionable authority unless a qualified individual has been determined to be the person that should do that. And so with this, we kind of have a unique thing in Minnesota. And if this is not true anymore, at least it was the last time I gave this weather talk, where once the game starts, the officials take over. And I personally don't agree with that. Athletic trainer should not just be the person who's necessarily calling for lightning at the beginning of the game, but should be the person who's doing it throughout the game, mainly because they're the ones that are going to have the access to those resources. And so those calls are not always the most enjoyable or the most fun to make. I would say they never are. But it is an important thing to do, especially since it's a really easy way to keep people alive and safe. Use a reliable means of monitoring the weather. We use a ton of different ones between forecasting out and then adequately monitoring the weather at Hamlin. I do a lot with NOAA and the National Weather Service kind of website. They've got an IDSS tool that spells out everything from wet bulb to lightning risk throughout the day. That is a really awesome tool that I recommend everybody use. And then for my lightning tractors, we've got Perry through TCO, which is nice. I've got a lightning tracker that I paid for personally, and I've got WeatherBug. I also have a radar app. We do a lot with weather prediction because we don't have necessarily the indoor facilities to be able to just move everybody inside without drastically impacting practices. And so our goal is to make this as easy for the coaches as possible by making it so that they have as much time to plan as possible. Well, identify locations safe from the lightning hazard. This is also going to impact your EAP or your policy with lightning. If you're like I was when I was in Indiana, where the closest shelter is the parking lot, and the parking lot's a 5-minute walk, you're going to make it so that maybe you're not doing the bare minimum as far as mileage goes, where it's 10 miles. You're probably doing 15. And that was what we did in Indiana. We had as soon as lightning was within 15 miles, we would shut everything down. And that gave individuals enough time to get to not only the locker room, which was quite a ways away from the football field, but also the parking lot. So those locations are going to be important for building that specific criteria to suspend and resume activity. And with this, really, we're just going to go, we're just following kind of best practices. We're following that NCAA kind of the position and consensus statements. With this, it's typically 10 miles. Depending upon your location, you might have it more. You certainly shouldn't have it less. Nor would that be best practice. But the big thing here is just making sure that we are doing this. We're establishing that specific criteria to suspend and resume activity. And once that's a policy that's agreed upon by the institution, that is your standard, and you should hold to that. Does this mean that we're going to do anything super crazy here with the mileage because there was a lightning bolt in Texas that was like 500 miles long? No. But it does mean that we're going to do our best to make sure that individuals aren't put in a situation in which they're going to get struck by lightning. And so this is where, if you have a policy, you review that with your coaches and you do those touch points early and often, that friction tends to kind of melt away as they understand that, yep, this is what we agreed upon as an institution, which is why we have to do this. I'm somebody who says, yeah, blame the policy. Be like, hey, what am I going to do? It's the policy's fault. We got to do this. I'm going to always say that I support the policy, but being able to kind of point to that in a meaningful way really does make it easier to make those calls. From a weather standpoint, we have not quite escaped essentially some of the issues that we have with wildfires in the fall. And this is just something that I like to draw a little bit more attention to than it gets drawn typically, mainly because this is relatively underlooked at. So the NCAA is just starting to provide recommendations, but 99% of the global population is exposed to unhealthy levels of air pollution. And for us in the metro, in the Twin Cities, it's constant. We're constantly surrounded by traffic. We're constantly surrounded by pollutants. And this can negatively impact physical and cognitive performance. Telling coaches that, like, hey, air quality index is a significant predictor of errors in the majors and then also quarterback performance in the NFL does make them think about, hey, we've got wildfire smoke and we're practicing during rush hour. Maybe this isn't a great thing. And so pollutants do play a large role in things. As we get into, maybe we've got some non-traditional practices where individuals are indoors and practicing in ice rinks. We see that it's typically worse inside. Got a 20 to 43% prevalence of EIB in figure skaters and hockey players and short track speed skaters compared to 10% of the gen population in Summer Olympians. And so we see that these pollutants, especially as we continue to get more and more individuals that have some form of breathing condition, whether it's EIB or asthma or anything along those lines, this is becoming a more important thing for us to look at. And so with this, as far as consideration goes, you can go and kind of build these in. The NCAA has very loose recommendations, and this isn't something that we're implementing policy-wise at Hamlin, but it is something to consider overall that, hey, maybe adjusting this, especially during, maybe some of the tail end of wildfire season, maybe that's just not a bad idea to make sure that we're putting these individuals in a good spot. Kind of, again, the unique thing about the fall is that not only do we get to deal with all of the different types of weather, I'd be hard pressed to think of a time in recent memory that I can think of there being wildfire smoke in March, but a lot of Julys and Augusts, I can think of that. But we're also dealing with just kind of the bulk of every athlete is coming back. It's the start of our year. And so these are not just considerations for fall sports, but just kind of considerations for your institution as a whole. And so with that, I'm kind of at the end of any big things that I have to say. My kind of final tips and my advice: use the information you have from your athletes to your advantage. Always more opportunities to improve healthcare. And I know that none of us have enough time, but there have been some of these things where investing the time in on the front end for me has been really beneficial. I would be hard pressed to probably find a high school athletic trainer that would be able to maybe do this, especially if they don't have access to all of this information. But this is something that I think does benefit you. Just getting opportunities to know your athletes a little bit better, especially if you're in the situation where you're fortunate enough, like I am, to where you get to see these kids every day and help them out. Policies and procedures protect you from unpopular decisions. This is one that really stems from kind of weather stuff, but really just with the amount of admin stuff I end up doing at the beginning of the year, I'm always reminded of this. Lightning strike today. We just send out to our coaches, yep, there's lightning within the area, and there's no question, there's no pushback, because we know that that's the standard. This is the established minimum standard. And so with this, as long as you're abiding by your own policies and procedures, you're in a really good spot. If you aren't abiding by those, I would say that you're in a really bad spot. You're in a pretty legally dubious spot as well. So, and that might just be a little bit of the admin teacher in me coming out at the end of this presentation. And then lastly, and this is a big one for me, and I have to remind myself of this every year, feeling a bit out of practice at the beginning of the year is normal. This is a huge thing for me. I typically will come into August and I will really feel like, maybe I wasted my summer. Maybe I didn't do as much continuing ed. Maybe I didn't take, enough opportunities to go and meet with individuals that I work with and try to better my skills. It's okay. It's not something that's necessarily uncommon. I think it's completely normal. And I also think that a lot of the things that you do at the beginning of the year and that you can do at the beginning of the year put you in a better spot for it. So I can't imagine at this point in time in my career just showing up on day one of fall camp, not having done all of this and feeling like I was ready to go. So with that, genuinely thank all of you. And I even typed it out because I really do love getting the chance to potentially interact with fellow colleagues, fellow ATs, individuals that are interested in this stuff. Please feel free to reach out if you have questions, or if you just want to chat, or just, anything. Doesn't matter to me. I've got a few different emails. Feel free to use any of them. And yeah, thank you, Matta, and thank you everybody for allowing me to continue to express some of my knowledge. Hopefully you found some of this beneficial. Thank you.
Blaine, thank you very much for that talk. On behalf of the Young Professionals Committee, which hosted this event tonight, and it has been sponsored by Twin City Orthopedics, we thank you all for listening. You will be receiving an email here shortly with regards to your post-assessment quiz as well as post-assessment evaluations. Once those are completed, you will receive your CEU certificate. As always, this is a member add-on benefit to our Minnesota Athletic Trainers Association members. And we do ask that in lieu of the registration that you get with that, that you consider donating to our political action fund to help us as we continue to work on updating and modernizing our Scope of Practice and Licensure Act. Our next Sip and Study Survey will be on Sunday, October 5th at 7 p.m., where we will be discussing wrestling basics. So we hope you all have a great night. Thank you.